The demanding schedule, the overwhelming amount of expectations.
There's a fair amount of pressures coming at us.
It's a question on every woman's mind. Can we have it all and be happy?
There are days, perhaps, that I may feel like I'm missing out on some things.
How to avoid the deadliest diseases.
About half the breast cancers that we detect now are not felt by the women themselves.
And exposing the truth behind women's health.
I think women owe it to themselves, and they owe it to us to keep themselves healthy.
Inspiring women to live the healthiest lives possible. A special edition of Your Life, Your Health starts right now.
Welcome to a KSL 5 News Special Edition, examining your life, your health.
Thanks for joining us tonight. Over the next 30 minutes, we'll be talking about some of the biggest issues surrounding women's health. Our first topic, many of us have already experienced, pregnancy. But have you ever considered much of what we know could be based on old wives' tales? Debbie Dujanovic investigates some of the biggest myths.
There are 56,000 women pregnant in Utah at any given time. But how many could score 100% on our pregnancy quiz? Let's see. True or false?
I've heard sleeping on my stomach while I'm pregnant could really hurt the baby.
Your body will get uncomfortable and tell you when you need to stop sleeping in certain positions.
Take extra caution during your third trimester. You see, sleeping on your back can decrease blood flow to the placenta, causing stress to your baby. Feel uncomfortable? Try using pillows to prop yourself up in a comfortable position. All right, next, fact or fiction?
I avoid eating seafood when I'm pregnant. The high mercury content will harm my baby.
Turns out it's not nearly as big a deal. The omega-3s have such a benefit, and the mercury risk is a lot lower than we thought.
McCarter says as long as women are not eating shellfish every meal, there's no cause for concern. Fact or fiction?
I've been trying to get pregnant for a year. I must have infertility issues.
To pick the time you're going to get pregnant is very difficult. It's more pick a window.
McCarter says not all fertile couples can get pregnant within the first few months, but do not get discouraged. There could be a number of reasons that could prohibit your family from growing.
A lot of times it's something that we can fix or help.
Myth or truth?
I heard expectant mothers should be eating for 2.
You're not eating for 2, you're eating for 1 and a tenth of a person.
Moms-to-be should only be consuming about an additional 300 calories for the baby and an extra 500 calories while breastfeeding. And finally, true or false?
Taking time to create a birth plan will help the delivery go smoothly.
Keep your doctor informed and work together as a team. It should be a fantastic experience for everyone.
Be open to last-minute changes and complications because, let's face it, they can arise. But be assured your doctor has your best interests and babies in mind.
We'll do everything we can to make sure that baby comes here safely and that 9 months later, you're holding a happy, healthy baby.
Because that's the bottom line, right? Here are a few extra tips to keep in mind. Start taking prenatal pills before pregnancy. Stay active throughout those 9 months. That will help with a faster delivery and a faster recovery. And if you experience any signs of depression, pick up the phone and call your doctor. Coined the silent disease, osteoporosis affects 80% of women 65 and older. It doesn't have any signs or symptoms, so most women don't know they have it until a strain or a bump or a fall causes a bone to break. Brooke Walker shares a woman's story who's not letting osteoporosis slow her down.
I'm going to be 85 in November. I ski all winter, play tennis all summer. I walk at least half an hour every day.
Born and raised in Germany, Ruth De Sousa has always loved to move.
But we did a lot of crazy things when we were kids. If my mother would have known, she would have killed me.
So when diagnosed with osteoporosis 20 years ago, Ruth wasn't ready to slow down.
Knock, knock, Ruth.
Hello.
How are you?
Okay. Can't just sit around all day and think you're gonna live.
80% of women 65 and older are diagnosed with osteoporosis.
Osteoporosis is a condition where you lose the strength or the matrix of the bone density.
After menopause, women lose estrogen, which helps support bone strength. Other contributing factors might include a history of rheumatoid arthritis, a diet poor in calcium and vitamin D, or drinking more than 3 alcoholic beverages a day. On the flip side, eating healthy and finding opportunities to move strengthens weak bones.
You need to be active and keep moving, because if you don't move it, you lose it.
Nurse practitioner Diane Kendall recommends women get screened starting at age 65. If osteoporosis runs in your family, talk to your doctor and find out when you should be screened. But fair to say, this condition has not stopped Ruth from doing what she loves.
If I couldn't do that, I don't know if I would want to live.
Gotta stay active. Use it or lose it, like she says. Next topic. More and more doctors are seeing cases of type 2 diabetes. And over the years, those patients have been getting younger and younger. But as Lori Pritchard tells us, the disorder is easy to treat by just making a few simple changes.
30 to 40% of the population has prediabetes.
A disorder of the metabolism. Type 2 diabetes generally considered to be a resistance to insulin. If left untreated, the consequences can be devastating.
It pretty much affects everything in our body.
Symptoms can include increased thirst, frequent urination, fatigue, blurry vision, or numbness or burning in the hands and feet. But the diagnosis doesn't have to be a life sentence. Diabetes educator Betty Wade helps her patients manage those symptoms. She says the most commonly asked question,
if I do all of this, will it go away? It never goes away. It can be controlled, but if we go back to old lifestyle habits, it'll come right back.
Betty says 90% of the patients she sees are looking to take charge of their health. Lori Payne is one of them. 6 years ago, Lori was diagnosed with type 2 diabetes.
I thought this is a great chance for me to change my lifestyle and lose some weight.
Lori says the biggest shock came when she was asked to exercise 90 minutes a day.
I was like, I can't exercise for 90 minutes a day. That's an hour and a half. How do you fit that into your already busy day?
Lori says taking care of her diabetes became her #1 priority until she was able to get the blood sugar disorder under control, turning bad habits into good. She ended up losing 35 pounds.
Well, I used to eat ice cream every night before I went to bed.
Now she breaks up those 90 minutes of exercise throughout her day and her diet.
So when I get up in the morning, I usually make myself a smoothie. The most surprising thing is just how much better I feel when I'm eating the right kinds of foods.
Now, that diabetes educator, Betty Wade, says the biggest roadblock when treating women is that we put ourselves last. So make sure to make yourself a priority, eating a healthy diet, and then set an example for those around you. Just ahead, we talk with one woman who said walking in high heels is more painful than this. We'll tell you what test is nearly painless, free, and could save your life.
Your life, your health, in partnership with KSL Intermountain Healthcare.
Heart disease, the #1 killer of women in the United States. When you think of symptoms leading up to a heart attack, you might picture the big crushing chest pain. Well, only 20% of women have those classic Hollywood symptoms. Women don't always recognize the symptoms associated with coronary artery disease. Most experience abdominal discomfort, back pain, nausea, and fatigue. If you've experienced any of these symptoms on a regular basis, especially over a short period of time, you should have a talk with your doctor and be honest about your symptoms. According to the American Heart Association, there are 7 steps to improving your health that will help you live a long and healthy life. Manage your blood pressure, control your cholesterol, reduce blood sugar levels, get out and move, eat a heart-healthy diet, maintain a healthy weight, and the best thing you can do for your health, quit smoking. Knowing your numbers is key when it comes to maintaining a strong heart. Those are good suggestions for all-around overall health. 1 out of 8 women in the United States will develop invasive breast cancer in her lifetime. 40% of lives lost to breast cancer occur in women in their 40s. Nkoyo Iyamba introduces us to a woman who considers herself not only a survivor, but a conqueror.
I am the Dean of College of Health Professions at Weber State University.
Yasmin Simonian has worked in healthcare her entire professional career.
And I'm a big advocate of not only doing breast self-exam, but also getting mammograms.
All right, follow me back through the door.
In 2005, Yasmin received a call she'll never forget.
I went for my annual mammography, annual checkup, and they called me back.
A biopsy revealed Yasmin had invasive lobular carcinoma.
It was a very subtle area on the mammogram, and she may not have been able to feel this for maybe 2 or 3 more years, at which time it could have advanced, gone to her lymph nodes, or gone elsewhere in her body. About half the breast cancers that we detect now are not felt by the women themselves.
Every feeling I had was activated. I thought, will I be around long enough? Will I be sick? Can I teach? Can I drive? Who's going to take me to chemo?
Every cancer is different. Each cancer has its own personality.
Yasmin decided to have a mastectomy with reconstructive surgery.
It's not as scary if you have a support system. It's not as scary if you have a physician who you trust.
A diagnosis of cancer is a terrifying thing. I think it is the thing that women dread most about their health. And I saw her go through this process with dignity.
Hi, how are you? Don't sacrifice the time that you will spend to go get a mammogram for not being around. You get squished, so what? The alternative is worse.
Women owe it to themselves, and they owe it to us to keep themselves healthy. We need you around, so get screened.
If you're apprehensive about making an appointment and having a mammogram done, go with a friend. Go with somebody. Call me. If you're diagnosed with breast cancer, it's not the end of the world. Live every day like it's the last day of your life. I'm not afraid.
To work or not to work? That is the question almost every woman faces. We take a personal look at 2 moms with very different lives, their decisions, their struggles, and how they found happiness. Making the decision to stay at home and raise your kids or join the workforce. No matter what the decision, it's never easy. Heather Simonson sat down with moms on both sides to find out how they balance in their life.
My mom was a stay-at-home mom, and just from a really young age, I could just tell that she really believed it, that was the way that she wanted her children raised, and so that's how I felt like that's the way I wanted my children raised. It was best for me.
Stay-at-home mom of 4, Ainsley, knew since she was little.
Hey, let's see your zebra.
This was what she wanted to do.
Go crazy. I just feel like I have such a short window that they're this age and home with me, and so I just don't want to miss a single minute of it.
We all have our own paths.
Dr. Terry Flint says when making the decision to stay at home
Come here, I'll hold your hand.
or work, look at the big picture.
It's about kind of coming to terms with really what's most important.
When I hear other people being introduced and, oh, she's a, mother of 4 and she's a doctor and she's this and that, it does. It kind of feels like, oh, well, maybe I should be doing more. But I just have to go back to my priorities. And as long as I've got those priorities in order and I'm focusing on that, then I'm happy.
Ainsley says the most important part of the job, spending time with her kids and being hands-on.
You got that slipped down.
She discovered in order to strengthen herself, she must strengthen those around her.
I've kind of lived by the motto, you don't make someone else's you don't make your own sugar sweeter by pouring salt in someone else's.
Her words of advice?
You want to surround yourself by people who are supporting you and then offer that support to other people.
For other moms, the choice to work was clear. Kim Brightwell opened up her own dance studio 10 years ago. She'd taught at other studios, but this was a dream come true.
My mother was a working mother.
Thank you, dancers. Good work today.
Working mom Kim has 4 children and says it hasn't always been easy.
Just trying to keep everybody feeling valued and positive, clean laundry and good meals and showing up to the basketball games and the practices and getting homework done. Sometimes those start to feel really overwhelming.
Terry says in today's society, there are 2 kinds of working moms, those out of necessity and those who are working for a career.
I really believe every mother is trying the very best that they can with whatever circumstances they happen to find themselves in.
And even though women don't always feel they're checking everything off the list.
I don't have a Ragnar sticker on my car, and to do it all. Be an amazing decorator, look like you're 22 still, and amazing cook, and you've got all these great talents, plus your home is beautiful, your children are well kept, some days, most days for me are the complete opposite, so.
I'm not going to worry about the what ifs and the shoulds and the could haves. I'm just going to focus on, wow, what did I do today?
When faced with the question to work or not to work, Terry says there's no one size fits all.
When we're being mindful about being in the moment and being fully engaged wherever we are, then we're happy wherever we are. That's the key. Be where you are.
Remember not to let others' accomplishments tarnish your own.
There are voices around us, but absolutely, the most critical one is often the voice inside of us.
And Kim says helping to support and uplift the women around you and making sure your children feel they're loved and important is an accomplishment we can all succeed in.
I know who I am, and I'm trying the very best I can.
And that's all you can do. Hey, the sun is out, the temperatures are finally rising. It's time to get outside. After the break, one of the best activities to do as a family here in Utah and the best resource to turn to. As women, we can have overwhelming expectations, but remember, don't pile too much on your plate. Keep your priorities in mind and know that what's best for one family might not work for another. Other reminders tonight: pay attention to what your body's telling you. Maintain a balanced diet and exercise at least 30 minutes a day. Exercise is a topic I love because most of my favorite things to do involve mountain trails. With the weather warming up, hiking's a perfect way to improve your health as well as the health of those you love. For a list of new places to explore, visit intermountainhealthcare.org and click on Live Well. You'll find a bunch of great hikes under the Move Well tab. And if you want more information on how to get healthy, you can visit KSL.com and click on the Your Life, Your Health tab on the right. Thanks for joining us tonight. We'll see you back here at 10 o'clock.